everyone. Thank you once again for joining Empowerment Network. Guys, we apologize for the delay. Sometimes we plan things differently, and of course, they turn out differently. This is technology, so there's nothing much we could do than what we tried to do. So thank you for your patience. Thank you for watching, for waiting. Today, we like you saw it, we have a very interesting and of course important topic, which says ONPASSIVE is going to improve healthcare access in Africa. And tonight, I am joined by a very respectable gentleman and lady who have done a few good things back home in Africa. And of course, they have touched in the health sector as well. So we are very interested to listen to them, what they have done. And of course, at the end of the day, what ONPASSIVE would do more than what they have already been able to do without ONPASSIVE. Hello, Dr. Bill. Thank you for coming again.
Hey, Comfort. Great to be back with you. And hello to everybody in the ONPASSIVE world who's watching and those who are not in ONPASSIVE. You're going to be excited about what we're going to be talking about today.
Yeah, sure. I'm definitely excited. Hello, Dr. Cheney. Thank you for joining Empowerment Network. Dr. Cheney, can you hear us, please?
Can you hear me, Dr. Cheney?
Hello to you all. Thanks for having me, Comfort. This is exciting.
Yes. All right. We're very excited and blessed, of course, to have you here. If you can hear me, Dr. Cheney, can you please tell us a bit about yourself? Can you hear us?
Losing you all.
All right. What I'm going to do
I'm having mic problems on this end. Can you all hear me?
I will call Dr. Cheney on WhatsApp. If she responds,
hear you. I can hear you some. It's breaking up though, and I can't hear Comfort anymore at all.
All right, guys, kindly be patient with us. This is a very important and interesting topic. Let's just be patient and see what Dr. Bill and Dr. Cheney have for us. So, Dr. Cheney, I'm calling you on WhatsApp. If that works, then you will speak to us through WhatsApp and not directly through StreamYard. So I am getting Dr. Cheney's number, guys. Bear with us. Sometimes these things happen, don't they? So there's nothing much we can do. However, we can do something.
I'm getting a piece of words here and there. I cannot really hearing any sentences.
Yes. Dr. Cheney, if you answer me on WhatsApp, I'm going to meet you on StreamYard. Then will you speak to us through WhatsApp?
Comfort, while you're getting that conversation technique set up, I'll tell people about Dr. Cheney. Dr. Cheney is a nurse practitioner, worked in the ER for like 24 years. And she's also been director of the Kabul Center for Skincare. And she's a doctor of naturopathic medicine. Okay. So Dr. Cheney and I have done mission work in Africa for 10 years together. She's often been the medical component of our trip. Sometimes we'd bring an MD, sometimes a DO, sometimes we would bring her, and she would always be there with the other parts of the team. So she was always involved in our Kenya missions for the past decade. I think it's from 2003 to 2012. So she's been involved in that. And recently she's been involved in working in with cancer patients and working with more of a holistic medicine. So those things are good. Have we got a connection yet?
Not really. So Dr. Cheney, can you hear me now? Oh, it's really bad, even on WhatsApp. It's all right. Can you come off? Let me remove you. Can you speak now, please? Okay, just remove yourself from StreamYard and speak through WhatsApp. Guys, we apologize. Let's see. Let's just give it a quick try again and see.
All right, so I'm going to leave the studio on
laptop and just talk to you on WhatsApp? Yeah, just leave the StreamYard and stay on WhatsApp. Let's see. All right. Can you hear me now, Dr. Cheney? Fairly well. Fairly well. Okay. So, guys, let's try this. If it doesn't work, Dr. Bill will definitely go on just like that, Dr. Bill. Sorry about this. So, Dr. Cheney, can you hear us? Just speak. Let me see if the audience can hear you, please. Even me here, I'm struggling to hear.
I think the internet connection must be defective somehow, because nothing is working, and I can hear Comfort well, but
yeah,
something's happening at that location.
Right. Well, so Dr. Bill, I think we'll just go on and then we'll try again later on. Dr. Cheney, just listen, stay on WhatsApp and listen. If we try again later on and you have an opportunity to speak, we would really like you to do so. Okay. So, yes. Yeah. All right. So Dr. Bill has just introduced you, Dr. Cheney, and yeah, Dr. Bill, I don't know where there's been this bit of confusion, but then we'll still definitely go on. So I know that you have done a few stuff as well back home. So if you can just kindly tell us, paint us a picture of what you have done from where to where and what all of those things, because we just want to know what you have done. How you did it? Did you face some challenges? What were the successes? And just tell us as much as you can, and let's have this chat. It has to go on.
Well, let's kind of give a small overview of my background, and then we'll go into what we've done here local in the community. And finally, we'll finish up with what we've done in Africa briefly and what we might be able to kind of showcase in the future. I've been in dentistry 50 years now. If you count my years in school. So 50 years of practice. I just retired, and I had a practice that was general dentistry. And I always felt like you should do more than just your part. You should do something to help other people. So my first mission experience was to Haiti back in 1974. And we worked mostly with local missions for the next 30 years. We started one thing called the Deserving Diva Foundation, which was a give back program to ladies who had shown that they were givers to the community. And we've made over their mouth, their smile, to give them something they could be proud of. So we did that for like 10 years, and we would have each one of our doctors in the clinic take on 1 or 2 cases a year. And so over time, we had quite a few people who had a restored mouth. And, the guys started complaining. So we had to actually get a deserving Devo also. So we didn't have just the women. We helped. But, most of the charity programs that we worked with were for women. But I do remember a couple of guys who came in and got some charity work done because they were in just as much need as the women. Along the way, I got to be on the board of directors of the Good Samaritan Health Center here in Gwinnett County, which serves underprivileged and people without insurance. And so that was an eye-opening experience. And it's one of the things I want to bring up today about improving access. If you can find a way to create a clinic that gives support to people who can't afford regular prices and regular care, then you're doing a good thing in a community. And that was one of the things that we recognized, that it's hard for a charitable clinic to stay in operation because donors are sometimes challenged and few, and volunteers are sometimes scarce. And so you end up having a service that's not well organized and not well maintained and doesn't have sustainability, right? And so we came up with a business plan, a game plan to create a charitable organization that ran successfully on its own. And so from a humble beginning, right before I started, it had been in existence for 4 or 5 years, but it was almost teetering on the brink of falling apart. And this one fellow that I interviewed today, actually on my influencer podcast, became associated with that particular charity, the Good Samaritan group, and he came from a profit background and he knew how to run a business. And so he decided, well, we're going to make this work instead of being a failure like most of the charities that were out there. Over time, they all fail because they don't have enough support. So he organized it and set it up to where it had a combination of a partnership between the patients, the providers, universities, the corporations, the churches, and the government. And between all of them, they came together and gave a little bit so that everybody could gain a lot. The patients were usually paying 20 to 25% of the cost of what it would be if they went to a private clinic. So it wasn't a free clinic, but it was a low-cost clinic. And churches gave to it, individuals gave to it, foundations gave to it, government grants gave to it. And as we found out, some volunteers would come in, but you had to have paid staff. You had to have paid nurses, paid doctors, and administrators to stay in charge. And so the little clinic that was seeing maybe 300, 400 people in a month started seeing more and more, 1,000, 2,000. And so the clinic grew from about a small little 1 or 2 building thing to now it's large. It's like 40 different service operatories for medical and dental and psychology counseling, and also for a pharmacy. So if you set up something that is a partnership, you're going to go a long way. If you set up something that is based on fee for service, but still a low cost, you can create a situation where the income from the clinic derives its survivability. And it's not that people come expecting free, they come expecting a better deal. And so that was kind of our model that we created here in Atlanta. And it's being exported around the country. People finding out about it, they want to know more. They want to know how it's going to work. And we're glad to share with people, the how and the specifics of it. But it's been the longest lasting free clinic in that area now. And most of the ones never even made it through COVID. Everybody kind of quit working in COVID because of the difficulties. And now it's doing well. So that's kind of the local story. And then over the years, of course, we went to Kenya, and that's kind of an interesting thing is that my cousins were challenged by my brother to go to Kenya and help build a building to make it a hospital clinic back in the year 2000. And so they went and built the building with the help of a partnership between the builders in Kenya. And so it was like 15 or 20 American workers, builders, went over and worked with 15 or 20 local Kenyans, and they partnered together to build the clinic. And they did it in just a 2-week period. They erected that building and poured the concrete and got it all done, put up the roof, the walls. And then the next year we went back and worked in it. I was the dentist, and I was the only medical provider there. So we only did dentistry that time. By that point, we didn't have electricity. We didn't have running water.
All right, Dr. Bill, hold on. That is one of the challenges, no electricity and stuff. But then I just want to also try to see if Dr. Cheney can at least say something. Dr. Cheney, did you get Dr. Bill Williams speak?
I can hear you all. It's faint, but I'm hearing you. Can you hear me?
Yeah, I can hear you really well. Guys, kindly let us know in the chat if you can hear Dr. Cheney so that she can at least speak to us. So, Dr. Cheney, just go ahead and say something, please. I know that Dr. Bill tried to say, he did really introduce you so well. So, having listened to him, just go ahead and chime in, say whatever you have in mind, since you know what we're here to discuss. Come on.
I didn't hear much of the intro, but Dr. Bill and I have known each other for a long time, so I think I probably knew what he said. I started my mission journey, I guess, in 1996, 1995, and my first 3 trips actually were to rural Nigeria to work with a group of doctors and nurses that were at the medical center where I was working at the time. And so it was a local, we didn't branch out very much, but we were in a small community, a rural village. And that gave me an opportunity to kind of see some of the challenges. And I think all through that country, the challenges are very similar. Water, sanitation, food, shelter. And that is a fundamental part of healthcare. When I started working with Kenya Medical Outreach, and I guess I was the second year, I don't know, Dr. Bell, 2002 maybe, I thought it was 2001. And I thought I met you all in maybe 2000, but it might have been a little after that. We added medical to that, and I had the opportunity to be part of that for about 10 years. And challenges were the same, and I actually we had a chance to see what can happen when a community does have skin in the game and they do take ownership for what's happening in their community, and they are proactive in that, and people give and they help support that. So we saw a community grow, and we saw a clinic grow, and so it is about taking ownership and partnering to keep something going and to keep it growing on a really functional basis. I've had a chance to do some work in Costa Rica and the Dominican Republic, and I think the underlying pieces are very similar, no matter where you go.
Okay. Yeah, thank you so much. I think for some reason, when I was preparing this poster, I thought that I should say how this is going to improve health access in developing countries, because I know that these things, they are similar in most of the places. However, we chose Africa. No problem. Let's go on. Just share the experience. So with all the challenges and all this, one of the things that both of you have said, which sound like, resonating with one another. Dr. Bill, you talked about partnership, and equally, Dr. Cheney talked about partnership. So if you can explain again, how would partnership help in situations like this? So just go a bit more on that, because we are learning, because we have opportunities here in our hands, and the future is waiting for us to do just what you have been doing and even more.
Partnerships are critical in places that are lacking in any resource. And the resource could be finances, education, infrastructure, transportation, communication. A partnership means that you're bringing something to the game that you don't already have. So you're joining forces, right? And so one thing is knowledge. One thing is understanding of systems. And one thing that you bring from the outside into an underdeveloped area is knowledge about how to do something. And so not only do you bring resources like medicines, but you have to bring in a system of how to apply the medicine properly. Now, one of the reasons that third world medicine might not work so well a lot of times is that it's not used properly. And so you're going to have a lot of waste and people doing things that aren't necessary because they don't know the specific procedures. An example might be people getting antibiotics and giving people injections of antibiotics for flu or for antibiotics for viruses, which does no good. And so there's a certain amount of knowledge that goes with medicine. And you have to apply it so you don't waste your resources you do have. Now, partnerships are important in sustainability too. If you don't have a partnership to train the people up to keep doing what you train them on, like a doctor could come in on a short-term mission, come and go, but it doesn't do much good except for that one person. And what we have to do when we're talking about helping a country or a region you've got to actually have it grow from within. It can't grow from without.
Hmm.
A mission team like we've been on will only be successful if it comes back year after year after year, or if your support is constant, or if you have an ongoing person on site to kind of shepherd the resources that come in. And so, we had a small example of success in that one town because we built the hospital, we came back, and we hired people to work during the year to keep the hospital going. And we actually had, a system and a funding mechanism to carry it a certain part of the way. But any country that's expecting another group or country to take it all the way is always going to fail. You always have to develop from within the partnerships with your government, your businesses, and the people to shepherd this thing through. And I always found that once people take responsibility in the country is the only time it ever starts to grow at a rapid rate, at a higher level. As long as they're waiting for us to come back every year, the region doesn't get more healthy that much. But when they take on and have a permanent nurse, when they take on and hire a permanent doctor, that's when things start to pick up. And the only way a permanent nurse or doctor is going to come into any area is if there's running water, if there's electricity, if there's a facility that they can work in where they can be used. So it's really important for every community to get the infrastructure right first. Without the infrastructure, the medical doesn't come. It's only first aid and patches if it's no electricity and no water.
Wow. Yeah, I know about the challenges of electricity and water and all of those. But then one of the issues you just raised, which I seem to be also worried about, is you talked about knowledge and stuff. So skills came to mind. Dr. Cheney, you also said earlier on that when you went, like in Nigeria, you partnered with nurses and doctors to do the bit that you had to do there. Given that Dr. Bill is saying without the knowledge, nothing much can be done because sometimes maybe resources are being wasted because people don't know how to use it. So would two of you agree that maybe investing a bit more first in training and giving this education would go a longer way than just going straight to deliver the help, because you cannot stay there forever to do it? So would it make sense to say that, all right, maybe we invest first on giving them the skills? And how much interest do they show when you say we want to train somebody, we want to train a group of people? Dr. Cheney, I hope you understood me, but I would like you to talk about that.
I do understand you. Honestly, I think Nigeria does have a system of medical schools and dental schools and nursing schools. And we did meet and work with professionals from all of those walks. I think with two of the things that I saw as real deficits was data collection about patients and cataloging resources. How would ONPASSIVE be part of this, or how would ONPASSIVE help to change this? And I think the access to the AI and to just a step up as far as
hello, Dr. Cheney, can you hear me? Can you hear me, please?
I can.
Yeah, you. It's kind of faint. Can you hear me? It's you're breaking up.
You're faint.
Yeah.
You're faint. My volume is all the way up. You're faint. But I can't hear you stop.
All right, go on. That Dr. Bill will also chime in, and I think we're going to have a complete story. Go on.
I think that now we have access to communication and the ability to catalog resources, and not just healthcare people, but all the auxiliary people, the plumbers, the farmers, the electricians, all the people that are necessary to build a facility and to keep it running. We have the ability now to put data together, to find out who's in the district, to go find individuals in a situation. And that's what's been missing in my experience.
Dr. Cheney,
that I've done.
Can you kindly just maybe walk around and see if it gets better somewhere, because it's really breaking up and we really want to hear you. Oh, it gets worse. All right, maybe you listen again a bit and then we find time and you come on, you try again. Is that okay?
Yeah, one thing Dr. Cheney was talking about was what's coming up probably with Academy and Connect, as far as the ability for us to project into different areas of the world, modern educational techniques and methods, being connected to the great doctors group, such that Dr. Kenor Shaw has put together thousands of doctors from around the world who are willing and able and have been sharing online their expertise. And so as we set up different ways for people to learn, and we advance healthcare and get access. Here's something that came up today in our talk with Dr. Greg Lang, and it was about setting up a clinic that is specifically focused, and its main purpose is training new people from the ground up to learn skills to go out into the community and do these services. And he was specifically talking about nursing assistants and dental assistants, people that are the frontline helpers in medical and healthcare. And so he was talking about having clinics that treat the indigent, but also focused on not just resources for indigent care, but training of individuals so they become useful throughout the community. So I think nurses could be worked in that area, dental hygienists, people of high value that need some place to learn, some place to get their hands wet with the real patients. If they can't go to a school that's more expensive, then maybe they can go to a clinic and get hands-on from the ground up experience.
Yeah, that is very Okay, Dr. Cheney, can you hear? Do you want to try again?
Not working yet.
No. Hello, Dr. Cheney. Hello. Oh, it's not the best yet. Okay, let me just. Okay, go ahead. I think it sounds better now. Carry on. Let's hear. Hello.
Yes.
All right.
I think Bill. I think Dr. You can take.
Oh my God.
And can you hear me?
It's just, it comes up and then it breaks again. I don't know.
Oh my gosh. Oh.
All right. I think it's really we really wanted to hear, because you probably wanted to hear from your own side. However, guys, let's see how it goes. Even if it means coming back again, we need to discuss this over and over anyway. So, Dr. B, one thing I want to know, because even guys, we know that we are here. The future is bright. All of these things, we're looking forward to make things much better for all of us, and of course, making the world a better place. So, Dr. B, many people are planning, like, I want to start up this, I want to start up that, and stuff like that. What would you advise? Because I think I listen a lot to when people talk about partnership. Would you advise people who are going to be equipped by ONPASSIVE to seek in partnering and supporting those who are already on the ground, or go start off something and seek your advice on how to move on with that?
And let's kind of break it down into some parts. The first thing I would recommend is how to develop a country in general, not just healthcare, but just any place that needs help. First, you have to look at sharing resources. You have to look at the resources that a family uses, and then maybe start to look at promoting education, as we talked about. And then we have to look at empowering women. Now, that's one thing Women has got in its plan already, is to elevate the status of women in importance around the world. Not that they're unimportant ever, but people don't tend to give them the same education. They don't tend to give them the same rights. They don't tend to give them the same responsibilities in some countries. So we have to have countries in general that want to promote be a better country, they have to look at that as an issue. Then we have to negotiate strategic political relationships that work. And there's a lot of that goes on that kind of keeps the country down, right? We have to reform systems of food and food distribution. And that's one of the things that's going to happen. So if you look at those as overall things, they're going to be impactful for health, right? Now, let's talk about specific strategies for improving health in developing countries. And things like the best thing that will ever happen for a country to get better health is to have long-term economic growth. As long as you've got a stagnant economy and people are struggling, the country has no taxation base. When you don't have taxes, you can't have public health. When you don't have public health, you have poor, unhealthy, sick people who don't live long and have, just all kind of problems. We also have to create biomedical intervention. That means we have to bring modern medicine to where we're using the latest equipment in the different countries. And that only happens when you have the infrastructure put in, a building to house the fancy biomedical equipment. Like if you want to have a heart-lung machine, if you want to have a bypass machine to do major surgeries, it's not going to happen in the bush. Right. So you got to have everything going in your direction if you're going to have major surgeries in any hospital, any city. You have to improve water sources and sanitation. You have to have better diets. We have to have dietitians who actually work with people on diets. We have to improve women's rights, as we talked about, and maternal health. Children in the womb have to be cared for as well as the mother. And there's certain minerals and vitamins that will be necessary. And if people are not getting enough folic acid, for instance, you're going to have some problems. If you're not getting enough selenium, you're going to have some problems. And so a lot of mental health and physical health issues will be avoided when you have proper nutrition for infants that are not yet born. And finally, there's always a need for cheaper drugs. Some of them are far too expensive. And we have to control the corporations trying to take advantage of people where they're making profits over people. Now, that's one of the things Dr. Kenora Shoa and us have been working to develop is bringing the doctors together to be more powerful as a group and trying to take away the power of the middleman, the insurance companies, the drug companies, those who are making all the money, and patients are getting less and less that they get to be benefited by the doctors that actually treat them. So the bureaucracy has to shrink and the patients have to get more for their money.
Right. I know these things, all of these things put together, Dr. Bill, there's one thing you said, which is a bit disturbing to me because you encourage something like strategic political relationships or relations. These are things that would be a bit beyond the capacity of a lay person like me, as a lay citizen, right? And you can't go to force your government, to do what you think that is good for your country. However, while we were discussing this, this topic was to see how ONPASSIVE would bring a difference. Do you think ONPASSIVE can break through the borders of these political relations thing? Because sometimes that is what the barrier that people face and stuff. Do you think with ONPASSIVE, people will still at least have improved health, life quality, and stuff like that, given what because you've been in Africa?
The biggest issue among all third world countries and many first world countries even is corruption and graft and nepotism. We're seeing nepotism in America right now at the worst, right? We're seeing the father and the son breaking the law in our country. We're seeing that. It's right out front. And we've got to have people strong enough to say, no, that's not right. In every country, there needs to be people that stand up, say, when injustice is going on, people have to stand up and say that's not right. And so in any case, if you're silent and you don't agree that there's something that needs to be done, if you just allow it to keep getting done, then you deserve what you get. So the masses of people around the world should always be vocal and banded together to speak their mind about what's fair and just. So that's part of the political process. And in America, they say one vote for one man, and we've even seen that eroded. And in a lot of countries, the vote is not sacred. It's not maintained. It's not fair. There's corruption even in the voting. So we have to clean it all up. And it starts with electing the right people. It starts with, having honest elections. So there's a lot of things that we used to stand for in America that we were the example to the world, and we've fallen down, and we're not. And so anywhere that there's corruption, it needs to be washed out. Anywhere that there's people that lead that aren't for the best of the people, they should be voted out and not lead. So that's kind of my soapbox of where I think we are right now in the world is you set a fine example until you don't. And right now, you don't follow what we're doing because I don't think we're doing the right thing in our country. But we know that there's an example of what should be done. And, who can be the best example right now? That's just the thing. We don't have a good leader to stand behind right now, do we?
Exactly. We don't. But then, anyway, things still need to move on somehow. But so let's try again to see.
Let's move to have Ash Mafarth be the one in charge. I think he would have a better system.
I wish we could have him be in charge. Yeah, go ahead, Dr. Cheney. I know you second that. Go ahead and speak. No, this is not fair at all. Oh, Dr. Cheney, we can't still hear you. Can you hear me?
I am. Oh my gosh, this is miserable. I can hear you all some, not great, but.
You're good right now.
Yeah, it's a bit better now. Just go ahead. Let's hear.
Well, a lot of what Dr. Bill is saying is on the minds of everybody here. We've got turmoil that needs to be straightened out, but to know that and admit that things need to get fixed is part of the journey. And I think that's a big piece too, is to admit when corruption and wrongdoing is taking place and to kind of put it on the forefront so that it is in the public eye, because we do have to help fix those things and to know about those things. And I think that needs to happen in all countries, third world countries and the leading countries of the world. Can you hear me?
Yes.
No. So I do agree with a lot of what Bill said. Those are conversations we've had for years now about how to do that.
Mm-hmm. She's gone.
I think in our dealings with each country that we've been in the mission field, we've seen the corruption and the graft.
Mm-hmm.
So that part's universal.
I know.
I don't think anybody's surprised by that. Everybody who lives in Africa knows about it.
Yes,
who lives in Central America knows about it. Every island of the Caribbean knows about it. So those are the things that are commonly known, and it's just a matter of speaking up.
Mm-hmm.
As Cheney said, shine the light on it, and shining the light on a lot of things makes them better. Might not fix them, but it makes them less likely to happen.
Exactly. It's just like you. I think, in other words, you just encourage people to be the change that they want to see, right?
Yeah, sure. I mean, the principles of ONPASSIVE that Ash has promoted, and especially through the OBLESS program, have certainly turned a lot of eyes towards the needs of the people around the world. And we're talking about functionally how to create his vision. You know, access to health in Africa is just an aspect of what we want to have happen with Obless. And it is not just Obless that's going to make it happen, though. The success of the individual with having an income is a big part of access to health. If you can afford health, if you can afford to go to the doctor, then you're going to be healthier. A lot of people don't go to the doctor because they can't afford it. And so ONPASSIVE is going to answer that perhaps as well as anybody. Nobody around the world is trying any harder than Ash Mufareth and ONPASSIVE to increase the income of the average person around the world.
Okay. Right. Okay. Yeah. So, Dr. Bill, I think we will just I don't, Dr. Cheney, can you hear me?
I can, yeah.
All right. So if you want to try to just try, if you can at least say something, then just to make a quick closing remark. I hope this really works. Go ahead.
The platform that Ash Mufareth has set out is a platform that needs a lot of support. It's a challenge. It is basically putting your money where your mouth is. It is standing up for the principles that need to come forward.
Oh my God.
Foreground, and I think it is bringing like-minded people together to be one with like-minded individuals in academic research and support, and part of what we achieve.
Oh my God.
Their support in their country, but one next to it. I think we all have to be.
Oh, Dr. Cheney, it's all we've lost it all. Can you hear me?
Comfort, my summary,
Yeah.
to finish up, is this. Healthcare access in all developing countries is just like this webinar. It takes a partnership. It takes everything working together for it to come across well. And for the most part, it doesn't work. For the most part, it breaks down. And for the most part, you have to live with what you get. And sometimes that's not fun.
Even though I'm laughing, it's not fun, but I'm laughing, Dr. V. That was a bright one. I'm sorry. Go ahead.
It's the pain of, and it's the joy of having the successes, but the pain of the defeats. And you know, in a developing country, nothing goes as planned. When you're on a mission trip, you always plan for the unexpected, and then it gets worse because you don't know what's coming. And what we want to do with helping people around the world through ONPASSIVE and the Obless mechanisms is we want to make life simpler, more predictable, and give ease and comfort to those who are hurting. And we want to bring opportunity to places that don't have it right now. So that's kind of like access. You know, we just have to do baby steps, incremental improvement along the way, figure out the partnerships at work, and empower the people on the ground to do the work to bring themselves up. And eventually, everybody's a first world country as time goes on.
Right. Yeah, I think, thank you, Dr. Bill. I really do appreciate, and I believe that it is doable, given that we are a new generation, we're a new type of people. Because why we brought this is because we still see hope, in spite of the fact that our countries might be making it difficult. But then we don't know how many people Mr. Mufareh is going to contaminate with his mindset. And one step at a time, someday, somehow, I think things will definitely be better than or as much better as we would like them to be. So I really thank you, Dr. Bill, for your patience this evening, and I really appreciated the analogy of the system we're working with right now, our StreamYard and the system back home.
Come on, ONPASSIVE Connect. We're ready for you.
Yes, yes, yes. We're quite ready. We're more than ready for All Connect. So thank you so much, Dr. Bill. And of course, you will always come back because there's a lot, guys. I think there's nobody now who does not know Dr. Bill except that you are new on this platform. Meanwhile, Dr. Bill also does this podcast. What's the title of your podcast, Dr. Bill?
The Influencers Podcast, and it's under my um, YouTube channel, Dr. Bill Williams on Passive.
Yes. It's very, very educational there. You learn a lot from different people of all walks of life. So let's just have a look there. Even there's a great one that was done just today. If we can just turn around when we find time and go there and have a look, and why not subscribe? Have a look at what Dr. Bill is doing. He has very, very much to offer us, and let's just grab the opportunity. Knowledge for free. That is, thank you so much, Dr. Bill. And thank you, Dr. Cheney. You definitely come back. So let's get things fixed. When All Connect is ready, you come back. You both definitely have to come back. All right.
Good to see you, Comfort. Thank you for having us over.
Yeah, sure. Have a wonderful evening, Dr. Bill. Thank you guys for joining, and see you soon. Thank you. Bye.